In this comprehensive video exploration, we will delve into 12 unusual signs that may indicate damage to your liver. Recognizing these signs is crucial, as it empowers you to take proactive measures to prevent the progression of liver disease. Contrary to the common belief associating liver damage solely with excessive alcohol consumption, various factors contribute to this condition. These include an overload of sweetened and processed foods, excessive intake of omega-6 vegetable oils and fast foods, frequent use of painkillers such as acetaminophen or ibuprofen, and infections leading to liver damage and hepatitis, among other factors. Stay tuned throughout this video as we not only identify these signs, but also discuss simple yet effective home remedies to detoxify your liver and impede further damage. The initial sign pointing to liver issues is the observation of light-colored stools. Ordinarily, your liver releases bile acids to aid in digesting fats from the food you consume, resulting in the typical brown hue of stools. However, in cases of fatty liver disease or liver damage, this bile flow can be disrupted, causing lighter or clay-colored stools. In some instances, the stool might even float on the toilet water due to undigested fat, making it buoyant. Another noteworthy sign involves experiencing difficulties with night vision. If you find it challenging to see clearly in low-light conditions, particularly at night, it could indicate a deficiency in retinol or vitamin A. The liver's role in vitamin absorption is crucial for the rod cells in your eyes to adapt to varying light levels. Liver disease can disrupt this process, leading to inadequate vitamin absorption and potentially resulting in night blindness. This symptom may also suggest a congested gallbladder, especially if accompanied by dry, sore, irritated, and gritty eyes. The third symptom on our list is a swollen right foot. When the blood flow in your liver is compromised, it can lead to swelling and enlargement of the liver. This, in turn, exerts pressure on the portal vein, causing the accumulation of fluid or water in the legs or feet. If you notice that your right foot or ankle is more swollen than the left one, this is a common sign of potential liver damage. Later in the video, we'll explore natural remedies to improve liver function. Sign number 4 involves the appearance of white eyelid growths, an unusual indicator of liver damage. These small white or yellowish growths around your eyelids are tiny collections of cholesterol deposits. They accumulate due to the liver's inability to break down cholesterol effectively, leading to its buildup in various parts of the body. Sign number 5 is experiencing pressure on the right side, potentially indicating liver disease. Liver damage can cause bile to become thick and sludgy, blocking the small tubes connecting to your gallbladder. This blockage results in a feeling of pressure and discomfort around the ribs. Moreover, this pressure can affect the phrenic nerve, causing muscle tension and pain in the region around your right shoulder. Moving on to sign number 6, the presence of purple and red spots on your skin. When your liver is congested, inflamed, or impaired, it produces fewer proteins necessary for proper blood clotting. Consequently, you may be more prone to bruising, and occasionally, you might notice unusual purple or red bumps resembling a rash on your skin, along with small red patches. This often occurs in areas like the lower legs or arms, attributed to diminished blood circulation associated with liver disease or possibly diabetes. Continuing with sign number 7, we explore cracked heels. Your body relies on vitamin B3, also known as niacin, to maintain the strength, smoothness, and moisture of your skin, preventing it from getting damaged. However, if you're dealing with liver disease, your body redirects its niacin reserves to repair liver damage, leaving less of this essential nutrient for other functions. This redirection can lead to the skin on the soles of your feet and heels becoming dry and cracked. Addressing this issue involves increasing your intake of vitamin B3 and addressing the underlying problem, often fatty liver disease. Sign number 8 is experiencing a persistent urge to scratch the palms of your hands or the soles of your feet. This condition arises due to a buildup of bile acids beneath the skin, resulting from the liver's inadequate filtration of these acids. This buildup leads to an accumulation of histamines in the bloodstream, triggering the itching sensation. Sign number 9 involves having all white or clubbed nails. If your fingernails start turning completely white, losing their natural pink color, or adopting a rounded, clubbed, or bulbous shape, it may be a sign of significant liver damage or another underlying health issue. This condition can hinder the delivery of oxygen to the nail matrix. Interestingly, researchers in the 1950s found that 8 out of 10 individuals with severe liver scarring had nails that were entirely white. Sign number 10 is dark urine. Your liver plays a crucial role in breaking down old red blood cells, which contain a yellowish pigment called bilirubin. When your liver or gallbladder sustains damage, this pigment can accumulate in the body and eventually get flushed out through the urine. As a result, your urine may take on a very intense dark orange, amber, brown, or cola-like color because your liver isn't processing the pigment as it should. Additionally, certain medications, such as antibiotics, sleeping pills, or birth control pills, can contribute to this discoloration by placing strain on your liver. Sign number 11 is yellowed skin, a clear indication of significant liver damage. When your liver is not functioning correctly and is unable to effectively filter bilirubin from your blood, it can lead to a change in the color of your skin. This can result in a yellowish hue on the skin, a condition known as jaundice. Jaundice can be caused by various conditions, including hepatitis, cirrhosis, or drug and medication poisoning. If you experience yellowing of the skin, it's crucial to seek medical attention and consult your doctor. Lastly, sign number 12 is the presence of spider veins, resembling tiny red dots with spider-like extensions of blood vessels that become visible on the skin. These are blood vessels that have suffered damage because your liver is not effectively filtering out excess estrogen. Elevated estrogen levels can weaken the blood vessels in the veins, leading to their dilation and the appearance of these spider-like veins on the skin. If you notice any of these symptoms we've discussed here, it's strongly advisable to schedule a visit to your doctor and request an ultrasound examination for a more thorough evaluation of your liver health. Now let's shift our focus to how to reverse liver disease. As mentioned earlier, the liver undergoes 4 distinct stages of damage: initial fat accumulation, inflammation, fibrosis formation, and the potentially life-threatening cirrhosis. The good news is that the liver possesses the remarkable capability to fully regenerate and recover when dietary improvements and the appropriate remedies are employed. Let's go through the most important steps to reverse liver damage. Start by reducing your intake of sugary, starchy, and flour-based foods, such as bread, cookies, candies, ketchup, pancakes, pasta, and soda. A fatty or impaired liver is responsive to fructose, the sugar found in fruits, much like it is to alcohol. Include plenty of bitter and sulfur-rich foods in your diet. These can include leafy greens, artichokes, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pasture-raised eggs, wild salmon, oily fish, walnuts, onions, scallions, and broccoli sprouts. Foods rich in sulfur can aid in reducing fat buildup in your liver by increasing glutathione levels and supporting the detoxification of harmful substances. Start your day with a cup of homemade organic coffee, adding a teaspoon of turmeric. The polyphenols in coffee and the phytonutrients in turmeric are effective at reducing the formation of scar tissue in the liver and promoting its repair from damage caused by alcohol, drugs, or fructose. Consume at least 1 liter of high-quality mineral water throughout the day. This helps thin your blood and supports the liver in producing bile to break down fatty deposits for enhanced toxin filtration. Consider adding freshly squeezed lemon or lime juice to your water for additional detoxification benefits. These steps, when combined with lifestyle changes, can contribute significantly to the regeneration and recovery of your liver. If you suspect liver issues or experience any of the symptoms discussed, it is crucial to consult with a healthcare professional for proper diagnosis and guidance. Remember, the journey to reversing liver damage begins with understanding the signs, making positive dietary changes, and seeking appropriate medical guidance. Your liver's incredible regenerative capacity, coupled with a proactive approach, can pave the way to improved liver health and overall well-being.